Today we're going to talk about oral candidiasis. Oral candidiasis is an infection caused by the fungus Candida albicans. It accumulates on the lining of the mouth, which appears as whitish patches in the mouth, on the cheeks, on the gums, tonsils, and so on. Although candidiasis can occur in anyone, it is more common in babies and older adults, and also in people who have low immunity or an underlying disease. Candidiasis is a minor problem if you are a healthy person, but if you have low immunity, are immunocompromised, or have underlying diseases. The symptoms can be severe and harder to control. At first, there are no symptoms, but little by little, a white mass appears on the tongue, cheeks, and tonsils that can look like cottage cheese or curd. It may cause redness, burning, and swelling in the mouth, which can make it impossible for the person to eat. There's also a cottony feeling in the mouth, loss of taste, cracking, and so on. In people with weakened immune systems, or who are immunocompromised, for example, people with human immunodeficiency virus or acquired immunodeficiency syndrome, the lesion can spread to the esophagus, which can make things difficult. When swallowing, you will have a sensation that the food is stuck and can't go down. There are risk factors that make a person more likely to get oral candidiasis. One of them is having a weakened immune system. For example, people with human immunodeficiency virus or acquired immunodeficiency syndrome. This appears a lot in people who have this disease, people with underlying conditions, and so on. People with diabetes as well. Some medications, such as excessive or uncontrolled use of antibiotics, can affect the natural balance of the microorganisms that live in our bodies. This causes them to multiply, which is how the Candida albicans fungus grows. To prevent oral candidiasis, it's important first to use mouthwash, and second, to always visit your dentist. To have good cleaning, good oral hygiene, obviously you shouldn't forget to use dental floss. The treatment for oral candidiasis is to stop the spread of this fungus caused by Candida albicans. You have to look for the cause that is causing the oral candidiasis. As we mentioned before, oral candidiasis can appear in anyone, but oral candidiasis appears much more often in people who have underlying diseases, who have low immunity, or in people with human immunodeficiency virus or acquired immunodeficiency syndrome. If you enjoyed this content, please share it. Dr. David Campos reporting.